Hello and welcome, dear students. Today I'll be giving to you a case discussion on post-dated pregnancy. See, this is also a topic which can be asked to you in your examination. It's a very common case scenario that people, especially in government hospitals, the kind of population that comes, they want to wait for the normal delivery. All right, they want to wait for uterine contractions or labor to start on its own. They do not believe in induction, they do not believe in augmentation, so they wait and they wait and they wait. So post-dated pregnancy can easily be one of the cases that can be kept in your hospitals and can be asked to you. Now the Viva questions can go in which direction, what all can you be asked. So it's a very, very simple case. If you know normal labor, if you know induction of labor, you will be able to handle post-dated pregnancy as well. There is nothing new in it. What I've done is I've tried to club it with stillbirth, because sometimes what happens is that waiting for normal delivery, the most important thing that you are scared of is stillbirth or IUD, sudden IUD at term or full term in a pregnant female. Why so? I'll give you the answers when we're discussing about post-dated pregnancy. Plus, stillbirth per se is also an important topic. So I've tried to club these two topics together. So today we'll be discussing both post-dated pregnancy and stillbirth. So let us begin with the case scenario. So my patient, Mrs. X, aged 25 years, teacher by occupation, is the wife of Mr. Y, aged 26 years, again a teacher by occupation, belong to the upper middle class, is a primary gravida with LMP so-and-so, previous cycles normal, with the expected date so-and-so, making her period of gestation currently at 40 weeks 6 days. She has come for regular antenatal checkup and is a booked patient with us. Now, history of present pregnancy. First trimester pregnancy, this was detected by a urine pregnancy test following 35 days of missed period. History of spontaneous conception. First trimester scan was done.
Let's skip this part. Is there anything important that you'd add to this?
No, there is.
Then let's get...
It's a normal history. I'm skipping to the menstrual history then.
Let's get to the diagnosis then.
Okay, so since in my case, menstrual history, obstetric history, past history of this pregnancy is all normal, the examiner can skip these histories and can directly go on to the examination to just check on the examination. But at the level of postgraduate, even sometimes examination is skipped. Sometimes examiner will ask you only the examination part also. So if they directly ask you the diagnosis, never be startled. Just keep your calm and answer properly. So my patient, Mrs. X, primary gravida, currently a booked patient, currently at 40 plus 6 weeks of gestational age, with single live fetus in cephalic presentation, with most probably left occipital anterior position.
Okay, doctor, how will you define post-dated pregnancy?
So according to the latest guidelines, any pregnancy that has passed the stage of 42 weeks is called as post-dated pregnancy. There are different terminologies now available as term, early post-term and late post-term, and then proper post-term. But in that case, that terminology will differ and will come to you later. But there are certain ACOG guidelines which say the same thing, which we are going to discuss later.